I saw this thing fall out of a tree next to me, and it literally landed not that far away from me. And at first, I didn't want to touch her because I thought she might bite me. Before I knew there were cats and foxes in the garden, so I knew if I just left her there, she'd be food. And I just didn't like the thought of that, so I just picked her up and then I plonked her on my shoulder. And ever since then, we've just sort of been together. As soon as I saw her, I just thought Pablo, without even knowing if she was a male or female. But from day one, I felt very affectionate towards her, and she seems to show a lot of affection back to me. Who's that? The last year, I've been dealing with a lot of anxiety, not being able to go out and meet new people, and just kind of struggling with an awful lot of things.
So how's Pablo doing today?
Since I met Pablo, it's given me that extra confidence to meet people and go out and socialise again.
Does she have a favourite shoulder?
She does, and it's this one. I can't really think of life without her now, even though it's only been 3 weeks, which sounds crazy. Well, I knew from day one that there was something up with her because she wasn't flying around and she wasn't behaving like the other birds. And yeah, I just wanted to see if she gets better. I think the whole situation, a bird falling out of the sky that happened to land next to me, is very surreal. And I feel very lucky that it happened to me, to be honest. She's made such an impact. To lose her would be devastating, really.
This is Pablo, and I've come to see Jo. She's got a sore leg.
Hello.
Hi.
Hi, how you doing?
Not bad.
How's Pablo sleeping?
Some people will see parakeets as a pest. She's not an indigenous native species to the UK, but in her case, she is a pet to Luan, and they obviously have a very close relationship.
Can I have a little look at her?
Sure.
And just have a look and see how the leg's doing. She fell from a tree, right?
Yeah, she fell from a tree next to me. She still uses her leg, but she doesn't really...
She doesn't grip
grab
very
it,
well,
no.
does she? So I'm just checking whether she's actually able to use the foot to perch, because perching is so important for them. She's obviously using the left leg a bit more.
Yeah.
You found that when she's on your shoulder, she prefers to sit kind of one-legged.
Since I found her, she's been like this.
We just need to figure out why she's preferring to weight bear more with her left leg. And if she's not able to perch with the right foot properly, then she'll put all of her weight on the left foot, and that can lead to issues with the good leg.
Yeah.
So we just need to figure out why she's preferring to weight bear more with her left leg, even though she's able to grip quite well with the right one.
Yeah.
So I'm just gonna gently pop her in the towel so she doesn't get too stressed. And I'm just gonna quickly have a look at her 2 joints there. All right, Pablo. So what we'll do is we'll take an X-ray of her legs, and we can see how that joint's looking. She might have a fracture there, and infections can get into the joint.
Okay.
And so we want to make sure that she doesn't have that. To get good views, we need her to stay still, so we'll just give her a little bit of anaesthetic gas.
Okay. I'm remaining hopeful and optimistic, but yeah, I'm worried.
Okay, so if you want to wait for a little bit, and then I'll update you shortly when I've got some X-rays.
Okay.
Okay. Go. Hi, Nathan.
Hiya, what you got there?
This is Pablo.
Wow. So I'm guessing she's friendly.
Yeah, she's very friendly.
I think you turn into like the exotics vet now. We don't often get birds here.
Okay, Pablo, come on, darling.
So what are we doing then?
So we're going to take some X-rays of her legs. I'm worried there might be a fracture there. We'll have a look at the X-rays and have a look, but it's definitely that hook joint that's a bit swollen and why she's holding up the leg.
Well, let's hope you can find something on the X-rays and help her.
Okay, we're looking a little bit sleepy. Lights. X-rays. Nath,
Yeah?
I think it's a really bad fracture. You can just see the fracture there.
Wow. It's really painful.
And this was obviously the swollen joint because everything else is up inside, but when she's asleep, that's why we can't extend the leg properly.
So this isn't good news for Pablo, and it's definitely not what I was hoping to find. And I did think Pablo probably had a fracture, but not this high up, so it's a lot more serious than I thought.
Here we go.
Pablo. Hello. How is she?
She recovered from the anaesthetic really well, really quickly. But I'm afraid the x-rays didn't give us the news that we wanted.
Right.
The fracture's quite high up. Surgery is an option, but we have to consider that she's a really high risk for any anaesthetic. And obviously that one would be longer than the anaesthetic we did to do the x-rays.
Okay.
But she's healthy, she's good weight, she's eating, and so, you know, her chances are reasonable, but bird anaesthetic is really risky.
I thought it was going to be very straightforward. I thought she might need some medicine or an operation or even some physio. And no, it's very disappointing.
The surgery is very high risk, so we have to consider the other option, which would be putting her to sleep, because with a fracture like that, she's going to be in a lot of pain.
I'll have to give it some thought, but I probably will go ahead with the surgery.
They're not great options. At least with surgery we can try and fix it and potentially have a good outcome with a usable leg that's not painful, even though it's a higher risk because she's a bird.
I want to give her the best fighting chance. I feel like she's sort of turned up at the right time. She's helped me an awful lot. Now it's my time to help her. Here we are, Pabs. I've decided to go ahead with the operation. It wasn't too difficult to come to because the other options were so miserable. I mean, putting someone down that you love, it was a clear choice to go ahead with the operation.
Hi, Luan.
Hiya.
This is Scott.
Hi, Luan. How are you? Nice to meet you. Hello, Pablo. Aren't you gorgeous? All right, well, it's a big day, so let's go in and have a chat, shall we? Come on in. When Joe first showed me the x-rays, it was very clear that this was a fracture that needed to be fixed. There's two sharp ends of the femur, which is the thigh bone in the upper part of the leg, and they were broken in half and folded over. It's a pretty nasty break in this right leg, isn't it?
Yeah.
How are you feeling about that?
I'm upset to hear that, she's got such a serious fracture, but, I want to do the best for her, so go ahead with the operation.
Okay. The main concerns for us is the anaesthetic. But the problem we have with her is that she is going to need to be under anaesthetic for quite a while, for maybe anything up to an hour.
Yeah.
And that is always risky in birds. So we are quite concerned about that. And then of course, she's a young bird. And as a result, her bones aren't fully calcified and as hard as they should be. Mm-hmm. And so that will mean that there's chances that whilst placing a pin, they may fracture. So yeah, there's a couple of concerns we've got. Well, I'd say more than a couple. Mm-hmm. Hey.
She must be up higher.
You do. Hey? I see Daddy's quite nervous.
Yeah, I'm definitely nervous.
Yeah, I know. We're nervous too, because it's not something that you have to do every day. It's something that we have done a lot of research and a lot of study in preparation for today, but something that we're really, really hoping goes well and will give you the result you want, which is a bird at the other end.
Just fingers crossed. Literally in the last 3 weeks, we've bonded so much and so quickly, and the fact that there's such a risk that I might lose her, yeah, it's been difficult. Good luck, Pablo. I'm expecting the worst, but I'm hoping for the best.
We will give you a call as soon as she has woken up.
All right.
In the meantime, just cross hands, toes, fingers, whatever you can find.
Yep.
All
Thank
right,
you very
mate.
much.
Take care. We'll see you in a bit.
See ya.
Bye. Here's little Pablo.
Hello, who's this?
So this is Pablo.
Isn't she gorgeous?
Pablo. She.
Yes.
Chi.
Apparently, yeah, Pablo called Chi, yes.
Pablo is
Yes, that's the
Chi.
least of her worries today, Ems.
Yeah, I hear she's not doing so good on one of those pins.
Yeah, so the right leg has got a fracture, and that's what we're all here for today. So I think the big thing we all have to remember is it's all about efficiency. We need to make sure that we do things as well as we can, but as quick as we can.
Yeah.
So we just need to be the most well-oiled team that we've ever been to get the job done and
Yeah.
hopefully get Pablo through and back to Luan.
Okay.
We know there's risks, and I know that we all are nervous. I mean, I'm feeling nervous. I know that you guys are as well.
Yeah.
But all we can do is just do our very best. So we're breathing there, fine. So you can see those small light breaths there, okay? So now every 15 seconds, you're breathing. Right?
Yeah.
Birds are very delicate little creatures. They're very prone to stress, and under anaesthetic, they can just simply die. So it is a very nerve-wracking thing to knock a bird out under anaesthetic, and we need to make sure that we're all on our A game today. There we go, so knee there. Just feeling the fracture site properly for the first time. She's just so stiff. This fracture feels a lot different to what it looks like on X-ray. The muscles are so tight here that they've actually pulled this fracture underneath its knee. So it's like having a tip joint in its knee in the same position, which is clearly not correct. So what we've got here is very, very abnormal indeed. And because it's been like that for 3 weeks, all the muscles have contracted and it's led to a right mess. But unfortunately, I can't see how I'm going to fix this surgically, because to do so, I basically have to refracture the leg.
Is amputation an option?
I don't think we need to. The reason I don't think we need to is because she can feel her leg. She can feel her leg, she can place her foot, she can hold the toes around my finger. So I'm feeling now that actually we should pull out and we should allow her to wake up, because although this isn't a perfect life for her, I'd rather her be alive. And I think that she is relatively comfortable. I think that the fracture has healed, however badly. And I think that, Luan loves this bird, and I don't want to be the one that breaks his heart. Hello, sweetheart. Although we'd love to have pinned the leg, there actually was no need to. And even though it might make you look like you've got a bit of egg on your face because you thought you were going to go one way, but actually you went another, well, you've just got to brush the ego off and get on with it and get the best result for the animal. And for the animal, and I think for Luan, the best thing was to leave well alone. This bird is perfectly healthy. It has a weird short leg, but she's going to be absolutely fine. Welcome back.
I think she's hungry.
She's like, get off my leg. I wanted to have a perfect leg, but hey. It seems from the examination that we've done today that Pablo isn't in any pain. There isn't any chance that those sharp edges of the fracture site could cause any further damage. The healing's been done. It's not perfect by any means, but it's perfect enough.
Hey!
Here we go.
Oh, how'd it go?
Well, it was eventful. Your bird has something we're going to newly describe as a fifle, which is basically a very odd leg, knee, thigh joint.
So it's just a fused callus, so it'll always be deformed and she'll always have that kind of claw-like perch. But she can still perch and she's not in pain.
And is that not risk of infection or anything like that?
No, because the fracture is on the inside. The slightly sharp bit of the fracture that we can feel is on the inside of her knee. So it's protected from anything on the outside.
And it's great that we've been able to give back to you in one piece, and that's exactly what we wanted to do. And we know that we've gone through the process to try and give her the best treatment we can, and actually it turns out by doing nothing is the best treatment we can give her.
I really wasn't expecting a happy outcome, if I'm honest. I mean, I know I said I was remaining hopeful and so on, but just the chance of her not making it, I'm pretty happy. She's in good health and her foot's healing itself naturally, and that she can come to work with me tomorrow again, back to normal.
Ready? Ready? Yeah! Hugo and I, when we go to the park, we play a kind of game where it's like who's gonna move first. You kind of like duck around. Come on! Woo! one of us moves and runs, and we just run around and jumping. You okay? I've always loved big dogs. So I was going into the vets to buy some special cat food for our cat, and there was this beautiful dog in there, turned out to be Hugo. And basically the guy who had Hugo just said, "Do you want him?" And I was like, "What?" Thought it was a big joke. Basically, it just wasn't going so well with this person. Him and the dog just didn't really gel, and he wasn't happy and the dog wasn't happy. Lovely boy. And there was Hugo, just so cuddly and friendly, and yeah, he was so handsome, I just decided to go for it. Look at that happy face. Yeah, happy dog. When we met him, he had this lovable nature around him, but there was just this insecurity. You could see that he didn't quite feel safe in the world, and I really related to that. And I said that to him, and I said, you know, I'm going to take you by the paw and we're going to do this together. You know, you and me, we're going to feel safe in this world together. Can you do some up dog with me? No, just sleep dog. I work for myself, and I was finding that I could get a bit lonely during the day. Oh, very good, Hugo. And just being here with Hugo now just makes all the difference. We're not really nervous about his first vet visit. I think it's just to be sure and to be on the safe side. We just want to have him checked over. Every day I just look at him and just fall in love with him a little bit more. He's just the most gorgeous being, and I adore him.
I love you. Yes, I do.
You alright, mate?
Oh, I'm a bit nervous, to be honest, but there's nothing wrong with me.
I'm sure you're going to be fine.
Hello, you must be Hugo.
Yeah, this is Hugo.
Look at you. Hey, you've got to have a voice like that. Has he got a voice like that?
Hello, my name's Hugo. I'm very handsome.
He's absolutely beautiful, aren't you, mate?
I have a secret passion for big, buffy dogs, and he very much fits the bill. He's a perfect dog.
Should we go and see you in the consult room?
If I have to.
Come on then, let's go.
Natalie's just got Hugo, so we don't really have much history, so it's really important that we do a full physical exam just to make sure that he's healthy as he starts his new life.
I can tell you guys are a little bit in love already, aren't you?
Completely. It was love at first sight.
Can I have an examination of you, hey?
I suppose it's for my own good, isn't it?
Very rarely when I'm treating animals do I hear them speak, but for Hugo, he's got an incredible deep, booming voice in the form of Natalie.
The old ticker okay?
Sounds good, yeah.
Let's have a look at those big choppers, hey? Okay.
Ooh.
Okay. Is that the first time you've seen that, Natalie?
Yeah.
Whenever you see a lump in the mouth of an animal, that's always a concern. The reason being is they're very black or white. They're either completely benign and nothing to worry about, or fiendishly malignant. And the animals that have that type of tumour can be dead within months.
If it was anything untoward, would he be having any symptoms?
When it progresses, there's things like bleeding from the mouth. You might have some pain when he's chewing things. You might see some loose teeth. All those things might be something. Are you seeing any of that at all?
No, there's sometimes a little bit of blood if he chews like a really big, like one of those big rawhide bones.
Okay. So that's very much something that we need to look at straight away. It's not something we want to leave,
Yeah.
and particularly the love affair that you guys have already struck.
No.
We don't want to break your relationship up, and I think sometimes we have to jump on these things quickly
Yeah.
and just make sure it doesn't get out of control.
As a vet, we see relationships between owners and animals all the time. But the relationship that Natalie has with this dog so soon is incredible.
I'll probably be fine, Hugo. Eh?
She absolutely adores him.
Baby boy, you're gonna go for a little sleep.
And then after that, we'll find out what's wrong.
He's only just come into our lives, so I just can't imagine or think about it not being okay.
Natalie, you're staying with me,
See you
buddy.
later, baby.
My bite. Oh, God.
Come on then, Hugo. Good boy. Hey, Ems.
Oh, my goodness. Hello. I know you said you were bringing me a big dog, but this is...
A horse.
This is a horse.
He's a horse. He's a big, handsome horse. Yes, he is.
Hi, buddy.
Then what's your story? Hey?
Well, this is Hugo. He's a rescue boy,
Okay.
and unfortunately, I've just found a lump above his canine. It just looks a little bit nasty. And as you know, with oral tumours, they're always something to be a little bit wary of.
Yeah, absolutely.
So what we need to do is knock out this boy, and then we just need to take it out and send it off to the lab.
Okay.
What are you doing? Didn't come here for a haircut, mate. No.
Oh, I know.
Oh, so big and scary.
Come on. I know. I know. It's a horrid noise, isn't it? So you get used to it.
Good
You're
boy.
a big baby, aren't you?
Oh, my goodness. Is he snapping? Is he getting snappy?
To knock out Hugo, we need to place an IV catheter, which allows me to give him the anaesthetic he needs. But unfortunately, big Hugo is a bit of a baby, and he doesn't like the clippers.
And it's all done, see?
That is all done,
It's all
buddy.
done. There, you're friends again. Thank you. We're friends. All right, so sleepy time now. I'll get that nasty lump out of your mouth, shall we?
When we deal with these massive patients, it is a bit of a mission to get them anaesthetised appropriately and correctly while trying to manage their size. So it's definitely putting us to the test.
Okay, one, two, three.
Now that Hugo's under anaesthetic, I can really see this lump, and it's a very angry looking thing, and it's extending quite a long way down the enamel of his canine. So what I'm going to do is basically cut it off at where the gum line should be, and hopefully in future that'll mean that he won't bleed as much when he's chewing things. Right, well, Em's alongside anaesthetist, I need you to be chief lip holder.
It's not a title I get assigned every day of the week.
No. This isn't the most elegant of surgeries. I'm literally just going to have to lop it off and try and get it back to where the normal tooth gum interface will be, which is sort of right back here. That will just lift away. Okay. One nasty lump removed. All right, so that's that. He's got a lovely new gum line. And we've got the horrible lump off, so I think it's time to wake him up. Good boy, there we go.
Good boy.
There we go. Oh dear. If it is something sinister, it's really concerning. So we'll just have to wait and see, cross our fingers and hope for the best. Boy.
If you hear that there's something wrong with your animal, even if it's a small thing, there's always a slight cause for concern, because you just hope that it's not going to become a bigger problem, and hopefully it's nothing to worry about. So I'll try not to think about it. Oh, I can hear. Hello.
Here you go, who's this?
How's my boy? Hello. Hello. It's me. I cannot believe you're not more excited. Oh, you a bit dozy. How's your mouth, Poppy?
Yeah, I'm really happy with the result.
Yeah?
It came away really nicely, and now he's got a nice, clean gum line. You'll be able to see. So that's normal. And then this is the new one. So you can see it's nice and straight and clean now.
Oh, yeah.
Yeah.
Wow, what a difference.
So I think that just by removing the tumour, it's going to improve his quality of life, because the bleeding that you've seen, I think, is because that growth, whatever it turns out to be, has been growing down the tooth, and as a result, has led to just getting in the way of normal chewing and biting and things. So I think we're going to have made a big difference to that. And now we've just got that anxious wait for the next few days.
The results.
Yeah. You a bit anxious too about it, hey?
Yeah. Very happy that the lump's come away, that it's come away clean. Obviously apprehensive about the results, because we still have to wait a few days for those. And, you know, just hoping for the best, really. You know, coming in for a health check and then spotting something, and to have it treated very quickly is brilliant. And then Hugo will hopefully be okay, and life can resume as is, the new normal with Hugo, which I can't imagine a normal now without Hugo, because it's just such a fabric of my life already. Come on, Hugo.
Come on, champ. Wake
Come
up.
on, big fella.
Time to go.
Let's go home.
Good boy.
Off
Here we go. Good boy.
Thanks, Scott.
All
See
the
you
best,
soon.
Natalie. Bye, Hugo.
Bye.
Bye, handsome man.
Thanks, Scott. Bye.
Bye, mate.
See ya.
Bye.
Hugo, what's this? Are you interested or do you just want to sleep some more?
Is it steak?
No, it's dog food.
Oh, I want steak. Well, what are you having for dinner? Can I have some of that?
Hugo's favourite snack, I think, has to be cheese. It's closely followed by eggs, tomatoes and grapes. Here we go, dinner. Yummy. Scott gave us a call the other day to tell us the good news that he has the all clear, which is, yeah, brilliant, brilliant news. Mwah. I was saying I wasn't worried, but underneath I was just desperate to get those results, and I don't think I'd realised how worried I was until we heard that he was okay, because I got really teary and was just so relieved. Who's this? Who's this? Oh! Hi, Hugo! What a greeting! Hello! Come on, Bella! Come! What are we doing? Hiya! It's always a little bit special when someone opens the door and I'm greeted by the big, handsome, gorgeous, wrinkly face that is Hugo with his big slobber chops. What's this, Hugo?
Oh, cheese. I love cheese. Give me paw. Oh, good boy.
So nicely as well. Oh, you love the cheese. I love Natalie's Hugo voice. That is completely how he would sound. Would he be human? Oh, big boy. It might sound mad, but it kind of keeps me sane. And I hear the best part of all of this is that he's had the all clear from Scott.
Yes, he has. Such good news. And then I was a bit emotional when I heard, because I was just so relieved. So relieved. I just got a bit teary. We were out for walkies, weren't we, when we heard the news?
Hugo, can I have a look at it then? Can we have a peek
Gonna
to
show
see?
Auntie Emma. Hey. So since the surgery, Hugo's mouth is looking brilliant. There's barely a sign that any surgery has been performed. His gums are looking healthy, his teeth are looking great. So yes, very pleased with his progress.
Sometimes I think you're a dream. I do. Breaking hearts all over the place, you, aren't you?
Go on, give it a kiss. Oh, Hugo loves the ladies.
Thank you, and you. Hello.
Naomi has brought Pablo in today because she left him at home yesterday, came home to find that he was limping.
Excited to be here. Good boy. Good boy. I tried to pick him up and he's doing this almighty squeal. He just would not move. It was absolutely heartbreaking. I just wanted to wrap him up in cotton wool so I could get him to the vets to see what's the matter.
Hi, Naomi. How are you? Hi, I'm Scott. How are you? Nice to meet you. Hello, handsome. He's lifting that right leg up, isn't he? What I might do is just get him to have just a little pot around, because I'd just like to see what's going on with that leg, if that's all right. Okay. It's quite ginger on that leg, isn't he? Just a bit sensitive. Well, there's definitely something wrong with that right leg. There's no doubt about that. So come on in. That's it. Good boy.
I'm just really hoping that he can just give me some answers and help me find out what's wrong with him.
Is this the first time he's ever had problems with this right leg?
He has had a few incidents before when he was a tiny baby.
Okay.
And then
What had happened on that incident?
He got attacked by another dog on one of his very first walks.
Oh no, what a nightmare.
Not good.
Yeah.
A couple of months later, he went to spend a weekend at doggy daycare. I genuinely think he probably just overdid it. We rested him. Within a day, he was back to his sprightly self, absolutely normal.
Okay.
And then this has happened.
Oh dear. Well, let me have a little feel of this leg. Just holding him around the shoulders there.
Come on.
Okay. Good boy. Let's have a feel.
Good boy. Shh, shh, shh. All right, all right, all right.
Okay.
All right.
Well, you didn't like that, did you? No, you didn't. Okay. Well, straight away I can feel that the problem's in the hip.
Okay.
Because I just tried to extend his hip and he really didn't like it.
Good.
But actually,
All right. Shh, shh, shh.
bending his knee
Steady.
is fine. All right, champ. All right, mate. Oh dear.
Good.
Oh dear. Oh, that's still nice though. Oh, that's nice. I know. You're saying, I'll give you a kiss. I might nibble your ear off though if you do that again. Hey, oh, what have you done?
He loves this.
The way that Pablo is behaving and being so painful, I really think we need to push to the next step, which is x-rays. All right, you give Mummy a kiss.
Good.
Come on then, champ. Okay, break it up, you two. Naomi is obviously an incredibly dedicated owner. She wants the best for him, but he is a little baby and she's going to be worried about him. All right, you grab a seat.
Yep, no problem.
See you in a second.
Okay. When you hear your baby scream or your baby cry, it's never very nice, so I'm just hoping that Scott can help him today.
Hey guys,
Hi.
this is Pablo.
Hi, Pablo.
He has been described by his mum as a little bit of a tornado, quite
buddy.
the handful, and been quite calamitous across the course of his life. He got attacked by a staffy, bless him, when he was about 10 weeks old. He's had a little bit of lameness, his mum said, ever since. But last couple of days, he's been really, really sore on this hip. So in examination, it was really painful. So, but he's getting on quite well. He's putting his leg down, so hopefully it isn't anything too major. Hey, Mummy's waiting upstairs for you. Hey, so let's give her the good news, hopefully. Yeah? We have to knock you out first, though, don't we? Yes, we do. Yeah?
All right, think about this. Think about
Good
this,
boy,
buddy. Oh,
good
what a
boy.
good boy.
Oh, brave boy.
Oh, he's a very brave boy.
Brave boy. There we go. Now he's asleep, I can examine his hip properly without pain. But this feels way worse than this dog is presenting. He was skipping around, happy, enjoying his mum's cuddles. But feeling this hip, there's something quite serious going on here. So what I'm doing right now is just rotating his hip joint, and it's like a grating sound. Certainly not the beautiful, smooth, healthy joint that you would expect of a 6-month-old.
I've never left Pablo with anyone that I don't know, and I've only met Scott for the first time today, so I'm very eager to have my baby back.
She was spinning around the other way. Look at that, guys. Automatically, I see that's a problem. One long leg, one short leg. And look, it doesn't even want to stay out. Look, it's just tight. Okay, let's take these x-rays, shall we?
Oh, poor Pablo.
It's really quite unusual to see one leg shorter than the other. And in this case, I think it's caught us off guard because it just shows that this is a much more chronic injury than Naomi or I expected. Hi, Naomi. Thanks for waiting. I've got something I need to show you, so I think you should come downstairs. Okay. Come on down. So, I just need to show you these x-rays. It's quite a shock, actually. Yeah. What we're looking at here is an actual fracture, a broken bone in his hip.
Yeah, that doesn't look good at all.
No, it's not a clean break.
No.
So what I think may have happened is, right back when he was 10 weeks old, this staffy has really done a number on him, and this is actually broken at that stage. And then over the time between then and now, it's tried its best to heal, but done a really poor job.
Yeah.
And every time he clatters around the house and knocks stuff over, he's re-breaking that.
Every time.
Yeah.
Okay.
So now I need for you to be brave because we need to do surgery on this leg. All right. I think what we're going to need to do with Pablo is perform something called a femoral head and neck ostectomy. It's basically removing the ball from that hip joint and just leaving a free-floating joint, and the muscles would take on the stresses and the strains of that joint.
Whatever he needs and whatever it takes.
Okay. Do you want to say goodbye to your chap? He's just laying just here. So you can, he's asleep, he's out of pain. All right, you jump in.
Oh, bless you. I promise.
You'll be okay.
So all of these things that all these things that you're seeing, it's just to help keep him asleep, okay? I know it's a little bit scary. The tubes are giving him oxygen and keeping him asleep, and he's got his drip on, and he's got various different machines to help us do our job.
Yeah.
Okay. I promise we'll look after him.
I know it's like seeing your baby under anaesthetic. It's tough, isn't it?
I'm feeling pretty devastated that Pablo's actually got a broken hip instead of just a little bit of a pulled muscle. My little baby, who I thought was a wimp, is actually a little hero.
you head off.
Okay.
And I'll look after your boy, and I'll give you a call as soon as he's woken up.
Okay.
All right?
Yeah.
It's a complete and utter shock that Pablo has to have surgery. Probably my worst nightmare.
We'll see you in a bit then, hey? All right, come on out. So I'm just going to start scrubbing. Every animal that we treat is loved by their owners, but I think that there is a very special bond between Naomi and Pablo, a little bit like mother and son, and he is still a puppy, so he's like her baby. So yeah, maybe a little bit of added pressure. So I'm just about to make the first incision to expose Pablo's hip. I really don't know what I'm going to find. I don't know if, based on that x-ray, if the femoral head and neck are actually attached or they're separated. So it's only once I get in through all the muscles and then into the joint capsule will I know, and then I know what I need to do, which is to remove that femoral head. This boy's got some insulation. He's a little bit on the portly side, isn't he?
Just a little.
So it's basically cutting through the skin, through all the support tissues, through muscle, to get to the joint capsule, which is basically the bag protecting the joint itself. Yeah, I'm just going into the joint capsule, so I'm finally going to see what the hip looks like. Oops, it's full of blood. Straight away, I know it's way worse than I even anticipated because blood comes flying out of that capsule, which just shows how traumatic the injury has been for poor Pablo. I've got my finger inside Pablo's joint capsule and I can feel the ball of the hip socket is not attached to his thigh bone. And you might think, oh, that's great, you know, it's easy, you just pop it out. In fact, no. Because I can't lever it out using his leg, I have to go fishing for it. And that actually is, yeah, quite difficult.
Yeah.
Oh, God, it's so awkward. That's the muscle that's giving me so much grief. Yeah. So just if you can try and keep that out of the way, and then I just.
Am I okay to hold it like this? No.
Yeah, that's fine. It is so difficult because the round ligament, the ligament that attaches the femoral head into the socket itself, has sort of grown exponentially, and that's probably because there's been a history of instability, and the body's a very clever thing, so it's tried to stabilize the joint, and it's done that by increasing the size of this ligament. But for me as the surgeon trying to get it out, it's meant for a lot more difficulty. Oh, come on. Come on. Okay. That's that fractured femoral head that we could see on that x-ray. Oh, look at how thick that round ligament is.
That's insane.
After I've got the femoral head out, the next step is just trying to make sure that there isn't any bony contact between the thigh bone and the hip joint. Because if we get any grating or any rubbing, that's going to cause pain, and that's going to mean that Pablo won't use his leg. So I use what looks like a chisel to basically get rid of any bony attachments, little bony pieces, make it nice and flat, and that'll mean for a nice, comfortable joint. Just little bits like that that are going to rub. Great, I can start closing up now. It's a massive relief to be able to close up Pablo and have him wake up. Here we go. Oh, look. Mummy even dropped off your teddy bear. Look at that. Hey? There you go. Good boy. It's possible that there could be more complications with this procedure just purely because of how difficult it was to get the femoral head out. But I'm hopeful that I've managed to get it out without causing injury, but let's see how he recovers.
I've been feeling nervous, excited to see him, anxious that he's okay because I'm worried that he might be missing me.
All right, mate. Good boy. Look at you putting that leg down. What a clever chap. What a good boy. Hello, mate. Oh, gosh, you're crazy, aren't you? Hey, you're crazy. Yes, you are. Come here. Come on then. Oh, let's go see Mummy.
I think I hear her. Let's go see Mummy. Come on.
I can't wait to see him.
Hello.
Hello.
There's your chair.
Hello. Hi. To have Pablo back feels amazing. I can't believe how much I missed him and how much he obviously missed me. It's so good to be together again.
Okay, down you go, mate. There you go. Right. There you go.
Hey,
So
hey.
you can see already how brave he's been.
Look at you.
Legs already
Look at you.
touching the ground.
Hello. Let me see. Look at you, brave boy. Yes, steady. Good boy.
He's already putting his leg on the ground there, which is just such a great result. But now is your turn.
Okay.
So what you need to do is start with some physiotherapy. So the most basic thing is just to get him to use this leg. We need him to use it as much as he can, as quick as he can.
Okay.
So the first thing is just lifting the other leg up.
Yeah.
So when you lift the other leg up, just ask him to put pressure on that leg.
Okay.
But he's been such a brave boy and such a great patient.
Good.
And now you just need to convince your boy to use his leg.
Yes, he will. Yes. I can already see improvements with Pablo's leg. He's spreading his toes a lot more than he was before, and he's putting a little bit of weight on his leg, so I can definitely already see improvements. And I literally can't wait to take him home and just get my baby back. I love him so much.
All right,
Ready?
bye, Pablo.
Say bye.
See you, mates.
Say bye. Steady.
Take care.
Steady. Good boy. Good boy. Come on then. Good boy.
Good boy.
Pablo. Ready, steady, go. Good boy. Come on, Pablo. Come on then. Good boy. Good boy. Clever puppy. Come on then.
Pablo is fantastic. He's making a good recovery. His muscle mass has started to grow a little bit more. He's using his leg fantastically. Anybody would think that nothing had ever happened to him.
This way. Where's Pablo? Hey, where is he? Hey, where's Pablo? Who's that? Hi, Naomi.
Hi.
How are you? Hi,
Good, thank you.
Pablo.
How are you?
Mwah. Good to see you.
too.
I thought I'd bring a little play date friend
Yay,
today.
We love new friends.
Yes.
Scott brought his puppy along so that Scott can see how Pablo can really move with other dogs, really see him in action. Also, it's really good socialisation for them. Go play then.
Wow,
Good
jumping
boy.
already.
Yes.
You're doing
Hello,
well.
darling. Hello.
He's looking very active
Yeah,
and
very, very active.
very comfortable.
Yes, I've got my dog back.
Pablo's moving really well, and most of all, he seems to be out of pain, so it all seems very positive.
He could never do anything like this before. His favourite time is coming out in the park. He
Yeah.
absolutely loves it out here. And you can
hear.
see, it's like he owns the place.
Yeah.
Stop. Come on, you two. Play nicely.
So often with patients, it's a mixture of physical and mental. And I think for him, he's lived pretty much his whole life with a sore hip
Yeah.
and not being able to use it normally. So now it's almost like you don't have a painful hip anymore. We just need to retrain you to use it.
Yeah.
And it's hard as an overprotective mum to
I'm
go,
terrible.
oh, my boy,
I'm
oh, he's
terrible.
jumping. But actually now, you need to just let him go
Let him
for
do
it.
it. Definitely. Definitely. The future for me and Pablo is to just enjoy a long, long life together, hopefully. Lots and lots of walking, lots and lots of treats, and lots of cuddles.
Come on, Scully. Good girl.
Pablo.
Come on.
Pablo.
They're already falling out. It's only their first date.
Good boy.
What are you saying? Let's look at this lumpy bit. Yeah, it's a real big lump, isn't it?
We were actually on a yacht off the coast of Corsica when it happened, and I got a call from Scott's practice to say that Bella had obviously suffered major trauma to her tail and that in all likelihood she would have to have it amputated.
Doesn't hurt, does it, Belle, when I touch your tail? Eh? Does it?
I don't know, I was in shock really, because when you're on a boat off the coast of Corsica and your phone goes, you don't really expect to be hearing that sort of news.
It's probably your curiosity that got you into this scrape with your tail, wasn't it, Bella? But we'll never know, will we?
The bad news was that the tail is badly dislocated, but the good news was that she had no other injury.
Nobody's going to see what a lovely tail it was when it used to stick up from her body at 90 degrees, and she was always...
She's been really crying loudly and making her discontent known.
Okay, come on then, Belle. Come on then. In you go. Good girl. Right, there you go.
So it's sad, but I'd rather have her safe, and she's got, I don't think it'd bother her at all, actually, because she's just that personality, but I think she'll just take it in her stride.
Okay, Belle, make yourself comfortable because now we're off, okay? Big adventure, Belle. Come on then. Come on, Belle. You're coming to see Scott, aren't you? Come on. Yeah, I know.
Morning, Kathy.
Hi, Scott.
Hi, Bella.
Hello.
Hi, gorgeous girl. Come on in.
Yeah, say hello to Scott.
Hello, beautiful. How's things? So it's been about 3 weeks, isn't it, since we've seen each other?
Has, yeah.
How do you feel things have been going?
She's been her usual demanding
Yeah.
cat with attitude self, jumping all over the furniture.
But we've still got a very floppy tail, haven't we?
Yeah.
To actually dislocate a tail, pull 2 vertebrae apart, that would have really hurt, and would have been done at quite some velocity. So generally it's a cat that's run, got caught in something, been run over, kept running, and the tail dislocates.
What I'm going to do is just do a quick deep pain test. I'm digging my fingernail in there, and there's not the greatest of response there. She should be really quite painful, and the fact that she isn't would suggest that there's a level of nerve loss or nerve damage. This tail, being that it's not being positioned properly, can be caught indoors, can be caught on fences, can be caught up trees. If she has a good tug on that again, it can go from a significant injury to an absolute nightmare. So I do think in this instance that it is probably the best option to consider amputating the tail.
If we don't take it off, every time she goes out, I'll probably always be worried that something's going to happen to it and happen to her because she can't control it.
So that's exactly where we'll take it off from that point.
Right.
The risks of doing this procedure are that as there is a huge amount of nerves at the base of the tail there, you can damage their ability to do things like control anal tone. So it might be, in worst case scenario, that she becomes incontinent. That's the worst case scenario.
Bella's surgery is a tricky one because of where the dislocation is in relation to her bottom. The base of the tail and where that is very, very close together. And there's a huge amount of nerves in that area. And if you cut the wrong one, you can stop her feeling that back end area, and you can lead to lots of problems, incontinence being one of them. And that's the last thing we need with Bella.
So you're poorly, Belle. But you're going to be fine, aren't you, Belle? Because you're a tough girl, aren't you?
Tough cookie.
You are. Yeah. It's funny, she's quite comfortable. Normally she doesn't like to be held by someone who's decided to hold her. She doesn't mind if she's decided.
I know, you're being affectionate to the guy about to take your tail off. Not a great choice. But at least she obviously trusts me, which is nice, isn't it? Yeah?
Here she is.
Hello, Bella. You're being
Hello,
feisty.
kitty.
Hey. You're not very happy now, are you, with that horrible
No.
catheter in?
No.
She's so beautiful, isn't she?
Yeah, she's a lovely girlie.
Look at the eyes on it, hey. They're amazing. It's such a shame. Take that beautiful tail away, but it's just floating in the breeze now. It's just an accident waiting to happen, so definitely the right thing to do to remove it.
Doing a surgery like this on a beautiful cat, it is heartbreaking when you have to change their appearance forever. To remove such a beautiful appendage is a real shame. She's a beautiful cat, it was a beautiful tail, but she will continue to be beautiful even when the tail's gone. Yeah, it's a procedure that I'm a little nervous about because it is a massive change for Kathy. The Bella is going to look completely different, but I definitely need to make sure that's the only surprise in store. And if a cat gets incontinence as a result of this procedure, then very rarely does the cat survive. Perfect. Good. There we go. Right.
Let's go.
Last time we're going to see this tail where it is. Quite a nerve-wracking one, this just purely because we've got a dislocation that's just so close to the base of the tail there. Lots of very important things in that region. Very, very high up.
Yeah.
Probably one of the highest up I've ever done. And bloody close to this poor little girl's bottom.
Yeah.
I had a cat through university that had a tail pull injury, and sadly after 2 weeks he was unable to control his bladder and his bowels, and he did have to get put to sleep. So I know the heartbreak of this type of injury and when it goes badly, and I definitely don't want that for Kathy. So I'm just to the point now where I'm about to sever the spinal cord, which is obviously a nervous moment. You want to be damn sure that you're in the right position. There we go.
There we go. It's off.
Yeah, sorry, sweetie. Right, let's get this closed up now, shall we? Kathy tells me that Bella is quite the fighter. I feel that that sort of tenacity is really going to help get her through, recover from this surgery and go on to live a happy life.
Beautiful. Even with the little tongue.
Yeah. What's that?
All right, Bella, what a good girl. Let's have a quick check. Hey, I know you're not happy about that collar, are you? I know, but it's got to stay on, sweetheart. I'm very sorry. I apologise. We took your tail. We're taking your dignity slightly. Good girl, good girl. I know, and keep your nails to yourself, please. Good girl. Bella, now. That's not going to work, my friend. Can we leave the collar in place for 30 seconds? Unlike the one you destroyed overnight. She's eating, she's drinking, her vitals are all within normal limits, everything that we'd expect. She's had a poo, which in the nursing world is thumbs up.
Hey, Kathy, how you doing?
Scott.
You all right?
Yes, I'm fine. How are you?
Good, yes, very well. And so is your girl. She's just through in the consult room, so follow me
great.
through.
Yeah, I'm excited to see her. Hello. Hi, Belle. It's been a big adventure, hasn't it, Belle?
So true to form, she's been quite the performance artist overnight. She absolutely ransacked her cage. She had this pulled off, but thankfully, she's left herself alone. So this is her new look back end.
Oh my gosh, that looks great, doesn't it?
So
It doesn't even look like she's had surgery. So I was really amazed, very pleasantly so, to see that it all looked so good. I mean, it looks like it was done, a couple of weeks ago. The hell? That looks great.
But I still think her name applies, in that although she doesn't have a tail, she's still Bella. She's still beautiful.
She is, yeah.
And I'm sure
she looks great.
I'm glad that you're happy with it, because it's a strange looking back end.
Yeah, but I mean, her fur will grow back.
The fur will grow back, and it'll literally fade away. And certainly from this cat's point of view, she's a feisty little madam, aren't you? And you're going to be absolutely fine, aren't you? Yes, yes, yes. Get me out of here before they take anything else off. I absolutely feel like we've all made the right decision. Not only does Bella seem more comfortable now the tail's gone, but it means that her future is secured, and now she can go out and about and enjoy the great outdoors yet again. And Kathy can be sitting resplendent on her couch, sipping a nice cup of tea without a worry in the world. All right, all the best. Bye, Bella.
Bye, Bella.
See ya.
Bye-bye.
Bye.
Mr. Lucky. Mr. Lucky. Bella, she's the boss, and generally it's quite a loving relationship, except that she can be quite horrible to him sometimes. She can spit at him 1 minute and then turn round and give him the most lovely grooming and lick his face.
Oh, Bella, that is nice.
Mr. Lucky just has to put up with what he gets. Everything has to be on her terms, really. He's obviously okay with it. Actually, yeah, I haven't forgotten that this is the cat flap. Big adventure. You can go out again. Yeah. Yeah, you're just familiarising yourself again with everything. She's just loving it, and she's just, her confidence, hasn't taken a dent at all. There you go, back in one of your favourite places, aren't you? She's always been a small cat with a big attitude, and she's exactly the same.
Hello.
Hello, Scott.
How are you?
I'm very well, thank you.
Good.
How are you?
I'm very well. I'm very much looking forward to seeing your beautiful girl.
Well, I think you'll be very pleased with her, actually. So come in.
Thank you very much. Let's have a quick look at this and just see. That looks great, doesn't it? I mean, obviously it looks a little odd, but the fact that she's functionally okay and toileting okay as well, that's not been a problem?
No, not at all. Yeah, she hasn't lost any confidence.
The fact that she seems completely unaffected by it, don't you? Hey?
You're still a total flirt, aren't you? Yes, you are. Yes, you are.
I've no regrets at all, and I think if any other cat owner was in a similar situation, I don't think they'd have to worry about it. It's just nice to see them going off and having adventures. But it's nice to see them coming back safely as well.
Hello, mate. You're standing a bit oddly, aren't you? It's not normal. Not normal at all.
It's incredibly upsetting when you see what neglect does.
Let's x-ray his hips. Let's see how good or bad his hips actually are.
Ted could need a total hip replacement. Now that's major surgery.
Today I'm on a beautiful drive out in the countryside to see one of my favourite people in the world, Jill, who runs the Border Collie Spot. She's given me a call because she's just received 2 beautiful Border Collie puppies from Ireland, and she wants me to take a look.
Oh, wish you could tell us what happened to you, I wish you could tell us. My name is Margaret, and I help to run the Animals in Need Rescue Centre in the northwest of Ireland. And we have puppies, Maya and Ted.
Mia.
They were surrendered to us, and when we got them in, they were absolutely riddled with worms. You're such a good boy. We also noticed Ted had very badly deformed feet. His back legs look like flippers, and the front legs are also quite deformed. And it is rather worrying because we don't know if anything can be done. Yes, I know. So the puppies will be going to London. Oh, you're a good boy, aren't you? Yes. Jill and Spot Collie has agreed to take the puppies, and Dr. Scott, we hope, will be able to work miracles and do something for them.
When Jill gives me a call, I come running because I love this lady.
Jill is a saint.
Curly! Curly!
She literally saves hundreds of Border Collies in the UK every year.
Come on then. Jim Jim. Good boy. Good boy.
Border Collies are my favourite breed. I love their intelligence, their loyalty. They're real friends.
Good boy. Yes, you are.
I mainly take dogs from farms that are neglected, unwanted. abused. Hopefully I can help them and give them a better life. Good boy. Oh, such sad, sad dogs arrive here. Although sometimes it takes a long time, it's wonderful to see them recovering and the light coming back into their eyes. That's, I suppose, why I keep doing it.
Hello, gorgeous Jill.
Hi, Scott.
How are you, lovely lady?
I'm fine, thank you.
Mwah. So who is this?
This is Mia.
Hello, Mia. Aren't you a pretty girl?
And this is her little brother, Ted.
Hello, Ted. Hello, mate. You're standing a bit oddly, aren't you?
Yeah.
Is that the problem?
Yeah. He's obviously got something very wrong.
Yeah, you're walking a little strangely. Mia and Ted both have very similar looking forelimbs. Both their front legs are showing some sort of bony lumps on their wrist joints. And that is something that's quite concerning and could suggest some sort of nutritional deficiency in their growth and development. Should we pop out the back and have a little impromptu consultation with these two? Yeah. Yeah? All right, I'll give you her again because she's a bit of a nervous walker, isn't she? She is. All right, I'll grab my box and off we go. Come on then, team. Let's go.
Come on. Mia has got the swollen joints as well, but I did feel that maybe that's due to poor nutrition. So I'm not as worried about Mia. It's more Ted. They had a horrendous start in life. They weren't looked after at all. They weren't fed. They were emaciated and really very ill. I never noticed any swelling on her back legs, not like with Ted.
There's a distinct swelling just there. It does feel bony in nature, and I'm assuming, like with all the waifs and strays that you take on, that they probably didn't come from the best of backgrounds.
Definitely not, no.
So my guess is that there might be a nutritional deficiency here, which has affected her in her early life, but now she's come to you and you've given her a good diet. These things are starting to resolve.
Yeah, I think now she's moving very well. Although these are still quite swollen,
yes,
it doesn't seem to affect her movement.
Well, do you want to sit up there on your royal chair and I'll have a look at your brother? After examining Mia, I'm pretty confident that this is a healthy dog. She just has some slightly strange looking front legs, but they're not affecting her at all, and I'm sure she's going to grow into a happy and healthy dog. Her brother, however, seems to have more than one issue, and he's the one I need to get to grips with next. Okay, Jill, so I need to see your little boy do a bit of walking. Okay. So do you want to walk over that way?
Come on, Ted.
Come on then, Ted.
Come on.
Good lad. That's a good boy.
Ted.
Good boy.
Good boy.
It's not normal. Not normal at all. He's very stiff on that back leg, isn't he?
Yeah, it's not right, is it?
It really is a very concerning moment when a young dog is lame and limping on a hip that should be completely healthy. They should be bounding around, and he isn't. And that really worries me for his future. Okay, I'm just going to extend this hip here.
Yeah.
Good boy. There's definitely something going on in this left hip.
Yeah.
There's a bit of clicking. He definitely resents me extending that hip. It hurts a little bit. Eh? For a young dog of his age, you know, he should have very flexible, very mobile hips, and this one, there's definitely some tightness. So I think that's probably the cause for his lameness at the moment. It's painful. He can't fully extend it. And in the worst case scenario, it could be something like hip dysplasia, where the hip just falls out of the socket, which means that he might need to have his hip replaced. So the same type of swellings that his sister Mia has. It's incredibly upsetting when you see what neglect does. And today, these two puppies personify neglect. But thank God for people like Jill who make a real difference to these dogs' lives. So what I think we need to do is take this young man to go and see my mate Michael, the orthopaedic surgeon, get him to have a little look. We'll do some examinations, likely x-rays, and look a little bit deeper into what the problems are.
Well, as long as we can do something.
Yeah, here we are again.
Yeah. The news Scott usually brings to me is that something is going to need major surgery and cost thousands of pounds that we haven't got. But even so, we always manage to find it. So no dog ever goes without treatment if it needs it.
Okay. Get you into the car, hey? Go see Michael.
Ted's been through so much, had such a terrible start to his life.
Say bye, Jill. Hey.
Hi, Ted. Good boy. And hopefully, if we get some good news today, he'll get into a loving home of his own.
That's it. Lovely. Good boy.
Bye.
Good lads. Good boy. Well done. Let's go see Michael. Good boy. Come on, mate. Here we are. Good lad. I know. Traffic and leads, hey? Come on. In you come.
He wasn't particularly keen on crossing the road, and then when he sees that he's confronted with a vet clinic, very keen not to go in.
In you come. Come on. Oh, you're going to make me carry you, aren't you? Come here. Come on. Honestly. Come on. Hello, mate.
Hello, mate. Good to see you.
And you, and you.
Nice,
So this is Ted.
Yeah.
He's from Ireland. How's your Irish accent?
Poor.
Yeah.
Poor. Fairly poor.
Me too, me too. I can drink a Guinness and that's about it. This guy, he is walking quite oddly on his back leg, on his back left. Today is a massive crossroads for Ted's life. It could just be that he has a slightly tight hip, that's a muscular issue that will resolve with physiotherapy or hydrotherapy.
Yeah, he's getting a bit tense there.
Or it could be as bad as a hip needing a total hip replacement. There's a massive spectrum there. We need to find out where on that spectrum he is.
Right. Let's just take him into the garden because I just quite like to see him moving around at a slightly higher speed. Right, okay. All right, mate, let's go. Let's go. Go on, Ted. Go on, Ted.
Good boy. Come on, then. Come on, mate. Good boy. Good lad. Good boy. Good boy.
So the reason we've come out here is we need to see him at a faster speed and then ideally in a nice straight line. And this works perfectly. This little runway number 1.
Keep going. Good boy.
Yeah,
Good boy.
go on, keep going, Scotty.
Good boy. Good boy.
Go on, Ted.
Good boy.
He's got what I call the supermodel swagger. So as he moves, rather than kind of pulling his hip through, he swings his whole pelvis forward. So he kind of walks like he's got a pair of Christian Louboutins on.
Come on, then. Come on. Good boy.
Michael's a specialist and always wants to have every bit of information he can before he makes a decision on what to do next. And I think part of that was making me look silly running up and down a laneway.
Hope you don't find anything wrong with me.
Go on, Ted. Yeah, so Ted's front legs are good, but Scotty needs an MRI, so.
Oh, no. Really?
When we got Scott to trot him up and down, his front legs looked quite good. He was kind of striding out quite well. He didn't look like he was collapsing down on his wrists. The only thing really of any note I thought was his hips.
Let's X-ray his hips. Let's see how good or bad his hips actually are.
Because at the minute he's a little bit of an unknown quantity as to what his prognosis is going to be.
Lovely. Job done.
Ted's swagger could be the result of poor diet or a lack of exercise, but the main reason why young dogs like him walk like he does is a condition called hip dysplasia. That's where the ball literally falls out of the hip socket joint over time, and that causes painful rubbing of the joint.
X-rays.
If that's the case, Ted could need a total hip replacement. Now that's major surgery requiring weeks of rehab. So we do need to understand fully what his problems are. When anyone takes on a rescue dog, I think the most important thing is they have a complete understanding of what the dog's issues are.
Okay, so here's his right forearm. There's his elbow, there's his paw.
And also to allow Jill to understand how long she's going to have to care for this dog, or can he find his forever home now?
So this is an X-ray of his hips. So these are the balls of the ball and socket joints. The balls are basically sitting quite well in the sockets. His hips are actually pretty good. I guess he could still snatch defeat from the jaws of victory, but you know, they're pretty good. So I'm really glad we did that. I can only assume that some of his muscles and some of the soft tissues are just tight. Probably because he's had no exercise, he's had a poor diet, etc. But from a surgical perspective, there's nothing for me to do. There's nothing, no tendons to cut, no joints to replace, no broken bones to fix. So I think he's going to be fine. I think he's going to be fine. I'd be very surprised now, based on that X-ray, if he needs any intervention ever. So that's really good news for him. As he just does more and more exercise and becomes more and more of an athlete and gets a good diet, he's going to be normal.
Hello. That was a good little wake up, wasn't it? Hey, lots of good news to tell you.
I think it's great news for Jill today. I think it's the chance that she can now find a forever home for this beautiful little dog, give him the future that he's looking for, and we'll keep a close eye on him to make sure that he does reach his full potential. All right then, mate. Well, thanks very much.
No problem.
Yeah, Ted says thanks very much.
Yeah.
Say goodbye.
Take it easy, mate. Okay.
All right.
Good to see you, mate.
See ya. Take
All the
care.
best, yeah.
Bye.
Right.
So it's rare, Jill, that I get to speak to you about good news.
Oh, that's good.
Yeah. The x-rays actually show that his hips are relatively good.
I was really nervous about what you were going to be saying to me, so it's really good news, isn't it?
So I think what we need to do is to allow him to grow, but also in an environment which is healthy, which is going to get good food, therefore good nutrition, and also exercise, which is absolutely key to develop physically as he should.
Yeah.
And my hope is that the lameness that he's showing at the moment will come right once he's just using his body the way it was intended.
Scott has given me the most amazing news. It is just a case of bad nutrition and neglect. So with care and love, he should recover well and hopefully be rehomed soon.
Good luck finding that new home, mate. You deserve it. Good boy. Yeah. Mwah. Good boy. You love him, don't you? You love him.
Ready, Teddy? You gonna spin? Good boy. Give me that ball. Give me. We were looking for another dog, and my wife Kim found out about Jill. So we decided to go down how we found Ted. It looked like he had a bad life. His fur was a bit rough. He looks deformed. Give me this ball. Good boy. Good boy. But it would have been so unfair to that pup not to give him a loving home. Right, there's a good boy. There's a good boy. Whoa! And we brought him home that day. He's very fast. You're very fast, aren't you, mate? I fell in love with Ted, and when we got Teddy home with Kenny, he settled in well, so they'll both go to bed together at night. Kenny, down. Teddy, down. Kenny, down. Ted plays all the time with Kenny. These two tend to be set together. Yes, good boy. I know you're tired. I know you're tired. Kenny and Ted have helped me in a way that I cannot explain. They're my little boys. The day that we actually were going to go down and pick Ted up was the day we said goodbye to Connor and we turned the life support machines off. Every family's worst nightmare. Connor was a 21-year-old, full of life. He was on holiday in Cyprus. He fell off a balcony and well, he died. It was such a shock, and Kim decided we're going to get a dog to take my thoughts elsewhere. Have you? Good boys, good lads. So I carry on, you know, and I look at my dogs and I just smile sometimes and get on with it, which you've got to do. You've got to do that. Teddy? Good boy, there you go. Another one? How many is that? 3? Another one? 4? I love my dogs equally. They both have a special part in our lives, mine and my wife, Kim. They're more like children because of the connection with Connor. Oh, mate. Ted? Good boy, Ted. I love them to bits, totally. Oh, very clever. Owning dogs is life-changing. Here we go, here we go. It's life-saving for so many people. Ring the bell. Oh, mate. They understand when I have the odd moment where I'm feeling a bit sad, and they'll come and they'll sit with me. And it's a race who can get to me first. You clever? Yes, you are clever. No, you're clever. I love you too, mate. Yes, I do. Yes, I do.
Do your hair. You have yellow ones in today. Honey is like my baby. She means the absolute world to me. We both would do anything for Honey. Oh, she looks beautiful.
She's a feisty little thing. She thinks she's a big dog and she's a little Shih Tzu. But she's had things from when she was a puppy. Nikki noticed this swelling.
Give us your paw. About 2 weeks ago, I'd noticed that there was something sticking out around her stomach. And then over the next few days, I monitored it and it looked like it was getting bigger. Barry said to me, we've had to take her to see Scott.
Come on, let's go. Where are we going?
Go, baby. Where are we taking you? Are we going to the vets? Are we going to go see Scott? Where are we going? Hi, Kirsty.
Fine, thank you.
Good.
How are you?
Honey, did you want to have a seat?
Yeah.
I'll be with you in a minute.
Thanks.
Nikki and Barry are the most conscientious owners that I know. They pick up on the slightest things that are going wrong with their dog and make sure that their vet, me, is aware of them. And that is just so helpful because then we can get ahead of problems and come up with good solutions. So I'm really glad to be working with them and Honey today.
You'll be a good girl.
Morning, morning Barry. How are you? Hi Nikki, how are you?
How are you?
Very good. Hello, Honey. Oh wow, look at you two matching today. You look absolutely beautiful. All right. Yeah, well, yeah, you as well. You as well. Honey always comes very well turned out. She always looks very beautiful with a different set of hair ribbons, and she's so sweet. She's just very kind as a dog. All right then, come on in. Let's have a little chat. Come on, gorgeous. That's you, Barry. So if we just pop you in a slightly unladylike position, I'm sorry.
Oh, baby,
Hey.
it's okay, it's okay.
All right, so flip it like that. There we go. All right, so we're not talking about this, are we? Which is this hernia. Yes. Okay, so that's just a outy belly button, umbilical hernia.
It's here. I noticed it because she does actually enjoy lying on her back. I just noticed it popping out when she's lying in certain positions.
So that does feel like potentially a liver mass. I'm really impressed that Nikki's been able to find this lump at all because actually when I feel it, it is on the inside of her abdomen. Honey's liver lobe has got a soft mass. It's probably about the size of a small apple. It's fairly large and quite concerning. What we'll do is we'll let her lay back and I just want to have a feel with her now standing up. There we go. Good girl. Okay. And has she been sort of well in herself and eating well and?
Yeah, she's been eating well and she's been well in herself, but she does seem to have lost a bit of weight because I can feel that her spine's sticking out a little bit.
Yeah, look, I can see so clearly here that we've got a very sharp spine there.
And that's only been in the last couple of weeks that I've really noticed that.
I can feel that her liver is very big, but the lump that you can feel through the skin is in fact one of the liver lobes. Also, there's the possibility that there might be a very small one here on the left underneath her rib cage.
I'm quite devastated really that he's found another lump. So at first I was thinking it's just the one that has to be treated, but now there seems to be two, which to me makes the problem a little bit worse than what we originally thought. So I'm quite worried. And is that on an organ or is?
This one also feels like it's on the liver.
Oh, okay.
Yeah.
What could have caused that?
Well, you're not going to like the answer to that.
I can't even imagine what it'd be like if she's got something serious wrong with her. She's my absolute everything. Yeah, she's come so far with us. 10 years, she's been like my best friend.
She is showing classic signs of some type of cancer. It's hard to hear, isn't it?
Yeah.
When you hear the word cancer, you immediately panic bells start ringing, don't they? So, you know, it's just probably as serious as we thought it could have been. So, we just got to keep our fingers crossed that Scott can work a bit of magic on it.
And she has lost weight dramatically in the last few weeks. 4 years ago, she started to develop some pain and she was crying out. Okay, baby. They diagnosed her with something called GME, like the dog version of meningitis. So she had a spinal tap and she had chemotherapy and radiotherapy for a long time. And then since then, she's relapsed twice. Oh, she's a lovely girl. At one point we thought we were going to lose her. And on top of everything else, she's got a heart murmur as well.
And is it treatable?
Well, this is a journey that we're all going to have to go down together. As we know with Honey, she is not going to be the easiest of patients to treat because she has that stonking heart murmur. I mean, it sounds like she's got a freight train going through her chest. Honey, it's fair to say, hasn't been the healthiest of dogs during her lifetime. And at this moment in time, I would say that I'm pretty confident this is going to turn out to be cancer. To diagnose this, we need to take some samples. Now, normally, you would open her up under anaesthetic, you'd go in, you'd take a sample of the liver, you'd send it away to the lab, and they'd tell us what we're looking at. Sadly, that's going to prove impossible with her. Today I need to keep Honey in with me here at the practice, and I need to do a number of tests on her, but I need to do it conscious, and that's because she has heart disease, and as a result she makes for a very risky anaesthetic patient. So instead, we're going to have to do something that's, although less risky, is quite nerve-wracking, because we actually have to insert a needle into her liver without actually being able to visualise it and to see it.
Is she going to be in pain?
There will be a level of discomfort to it, more than if you were going to knock her out under a general anaesthetic, absolutely.
And when will we get the results back?
So we'll get them back in a few days.
Oh, right, okay, that's quick.
Yeah.
Honey is so brave, and I think she's a lot braver than us, actually. She's been through so much. It's sad to tell all of our friends and family, really, because she's loved not just by me and Barry, but by everyone.
Come on, gorgeous.
Oh, there you go,
All
baby.
right. All right, do you want to give Mummy and Daddy a kiss?
Bye-bye, gorgeous. Bye-bye, baby.
There's the fan club. All right.
Bye-bye.
All right, guys, take care.
Thank you.
All right, see you later.
Bye.
Bye.
Bye-bye.
Hello.
Hello.
This
Oh.
precious little lady is Honey.
Hello. Look at your pretty bows. Very cute.
Isn't she an absolute sweetheart? Oh, but unfortunately, I'm a little concerned about what we're going to be finding today. She has been losing weight, and her mum's found a lump which she thought was on her tummy, but actually is what I can feel to be a liver mass.
Oh, that's sad news, isn't it?
The kicker to that, which will make you as her nurse quite nervous, is that we have to do it all conscious.
Great. Why?
She's got a massive heart murmur. She has done for quite some time, and that's a massive compromise to the anaesthetic. So we'll do everything we can to support her right now, make her as comfortable as possible, and hopefully she'll just let us do what is a pretty mean thing, and hopefully she won't hold it against me.
If it's less risk, then that's what we have to do, isn't it?
Yeah.
Isn't it, honey? Don't be brave.
Brave girl, brave sausage. So what we're going to do with Honey is give her some pain relief. To start with, we're going to locally anaesthetise the site as well. We're going to do everything we can to make this as pain-free as possible and get the cells we need to make a diagnosis. Okay, baby girl. A little bit of pain relief. Make you feel very happy. That's it. All right. So there's the lump there. Very prominent, quite large, quite concerning. Just about to do an ultrasound. It just gives us a bit more of a picture as to where this lump is and how it looks as opposed to normal liver tissue. Can you see that?
Yeah.
The lump looks big. I mean, it's half the size of a head. It's huge. I would be very surprised, shocked even, if this doesn't come back as cancer. Never have I wanted to be more wrong. Don't want to be right this time around.
So I'm just putting some cream on just to numb the skin, just so it's not as painful for her when the needle goes in.
Nice deep breaths. Let's all be calm for her. Okay, everyone ready?
It's a good girl. Good girl, honey.
That's a worry. So that is not blood that's come out of a blood vessel, but actually blood that's present in this tumour. So fairly nasty type of tumour. When there is a lot of blood cells present in a sample, it can affect the ability to interpret the result. So I'm a little concerned we might not find out what's going on with Honey with these tests. She was so brave, wasn't she? Hey, you're a little legend, aren't you? The news could be really bad. I suspect it's going to be really bad, which is really tough because she's actually quite bright and happy at the moment. Hey, you've been such a good girl. And look at that. Hey, orange dinosaurs. There we go. Orange to match. Hey, match your little hair ribbons.
Tonight we can't wait to get Honey back into the house, into a nice warm house and keep her all cosy. We'll give her lots of cuddles, lots of chicken and rice. She'll get really spoiled.
Where's Mummy? Hey? Where is she? Hello.
Honey bunny. Hello, girl.
There she
Hello, my
is.
girl. Hello, my gorgeous one. Oh, what's happened to you? Hey? Oh, Kelly. Oh. Oh, so she was good.
She was just an angel. Didn't make a sound, brave as they come. But the sample was quite concerning in that it was a little bit on the bloody side, which you might think, oh yes, he's just hit a vein, but that's unlikely because of how much came out in a short space of time.
Yeah.
But we just need to know what it is first.
Okay.
So, how are you guys feeling about everything?
A little bit shock, I think, really. Although we've been contemplating what it could be, it's still not nice. It still feels quite...
Well, you guys are such optimists, I can tell, and so you always think, oh, hopefully it's nothing.
Yeah. I think Barry's more positive thinking than me, but I will definitely try my hardest to stay positive over the next few days until we get the results and give her lots of love and lots of cuddles until we find out what the treatment plan will be.
And Nikki, there's a bandage, matches the hair, do you see? Hey, we do think about that sort of stuff. Honey is such a brave little dog, and under that beautiful fluffy coat is a heart of a lion. I really hope that in the coming days we get the result we're looking for and she can live a long and healthy life. But at the moment it's really tough to infuse Nikki with positivity because I am really concerned about what I've found today.
Should we go home? Shall we go home? Should we go see your daddy?
Hey, it's fair enough. You do need some more work on this hair. I did mess it up a little bit, so Dad's apparently the expert. All right. Okay. Well, you guys have a good evening, and I'll be in touch with the results.
Thanks
all right.
very much.
Okay, Nikki.
Thank
Take
you.
care. All right. Bye, girls.
She definitely is a fighter. She's 4 from 5 weeks old, and I think Honey will be able to get through it. Come on, baby.
It's okay. The Royal Veterinary College really helped out a lot, and we got an appointment really fast. So professional.
Hi there, Mr. and Mrs. Wilson. Nice to meet you. My name is Stein. Hi there. And this is Honey. And Honey, welcome.
Unfortunately, the sample that we took from Honey's liver isn't giving us the answers that we're looking for to understand what's going on with her. So now I need to refer her to my colleague Stein Neeson at the Royal Veterinary College.
Shall we get a room? Great, thanks.
He's going to use all the technology that they have there at his disposal to find the diagnosis.
So I've spoken to Scott, and we have agreed that the best way forward is to get better pictures of this liver. So the plan for today would be first to put her through the CT scanner, and after that we'll try to also have another go at taking a little sample of that liver to see under the microscope what kind of cells are there. So Scott already tried to get some cells, but they didn't give the answer. So what we're doing is we're stepping it up. We're going to use a bigger, bolder needle to get a bigger piece of that liver, hopefully giving us that answer whether or not it is cancer. She will be treated like a VIP.
Oh, good.
VID, I guess.
That's what she's used to.
That's yours.
Okay, baby. I'll see you later. Honey's just everything to me and Barry. She's a massive part of our life.
Good girl. Here we go. Here we go.
I just hope that when she comes around from the recovery that we've got some answers and we know what the plan is to go forward.
Good girl, honey.
Let's go to sleep, little one.
Good girl.
So she's nice asleep, she doesn't feel anything, but most importantly it allows us to take these detailed pictures that we're taking just now of her tummy and her chest. And that's all to try and figure out what is going on in that liver and is there anything spreading around the body, and that would of course be bad news. Looking at the images, it's one of the biggest livers I've seen in a dog of this size. You can see it's not the same color everywhere. You've got some darker bits, lighter bits. It's all very blotchy. That's not what we normally expect with a healthy liver. Whatever is going on there is growing in a big way. So now that we've done the CAT scan, what we really need is to get some cells from that liver to be able to look under a microscope and see what kind of tissue is there. Is it cancerous, yes or no? We are going to use a bigger needle than Scott used. And that is advantageous because we will get more tissue and we stand a higher chance of actually making a diagnosis.
Let's see what we got.
This liver is very mushy, and we can now also see why Scott had difficulties getting a diagnosis in the first place, because it's very easy to be in the wrong bit.
That's a much bigger chunk.
I'm very hopeful that we will get an answer for them today. We've taken good samples and the pathologists are going to get a look at them just now. So hopefully we'll have an answer for Barry when he comes back to pick Honey up. Hi there, Mr. Wilson. Okay. You
Hello,
are...
baby. Can I take her?
Yeah, of course.
Hello, baby. Hello. Here's a good girl.
Shall we go to a room and have a chat?
Yes, please.
Okay.
Come on, girl. Come on. Here's a good girl.
So we managed to do everything, which I'm really pleased about, because I think we've got now the best possible picture of what's going on there. And I have to say that that is not good news in that we do have cancer.
When you hear that cancer, I didn't know what I was going to do. It's the worst possible news that we could have had.
Now, some types of these cancer you can perform surgery on. With her, there's very little normal liver left. So I think she's coping better without doing the surgery than if we were to do the surgery. Okay. This is a slow-growing tumor, but how long is probably the question you're going to ask me. That I can't answer. That is something we'll just have to see. And although it's not what we wanted to hear, we can now make a plan for the future, because she still has a future. Yeah. And maybe we'll be surprised at how long she still will do well. I wish I could have offered Honey a solution, a cure. But I need to remind myself that it does help knowing the truth.
It's best if that we know, isn't it?
Absolutely. As long as she's eating and drinking and being happy when you come home, you can say honestly to yourself, she's got a good quality of life. There's no urgent action we need to take. So that puts us in a privileged situation in that we can now plan her journey and make sure that she has as many good days as possible. And should bad days start to appear, we can make quite a quick decision to make sure that she doesn't suffer. But until that time, we can have a lot of good days with her, giving her the best possible life, because we will have prevented any suffering.
Although it's devastating news and it's an awful thing to hear, I'd rather know and we can make it as perfect as possible for her. All we can do is make however long she got left special.
Mommy's been warming it up for you.
Yeah, come on then, it's a good girl.
Honey's behaviour has changed, yes. So because she's been getting spoilt every day, she will only eat roast chicken, and it has to be hot.
That's a nice bit, isn't it?
My friends are just absolutely devastated for me because they know how much Honey means to me and Barry.
There's a good girl. Lovely.
I'm really glad that we went ahead with the CT scan and to know the results really, because it means we can spoil her every day more than what she is already.
Well, someone's sounding feisty. Hey, Barry, how are you? Hi, Nick. Good to see you. Hello, gorgeous. You've still got lots of spirit, haven't you? All right, well, let's go in and have a chat about that nasty diagnosis, shall we? Hey, come on.
Honey is very clearly the boss of this house, and although she's unwell, she doesn't know it. She is really taking advantage.
Yeah, and she's living it up. She's got her own cushion, new toys. I mean, this is all sounding pretty good.
It's a dog's life, innit?
Yeah.
Thanks for all your help. You've been really supportive.
If anyone can live a long time and eat you out of house and roast chicken, it's going to be Honey, isn't it? Hey, you good girl. Yes, you are.
Honey doesn't know that she's sick at all, and she's so in tune with my emotions that if I show that I'm upset, she'll come straight over to me and be like, why are you upset? What's wrong?
Do you think she's making you sad?
Yeah, if she thinks that we were getting upset, she'd be worried that stress it out.
Oh yeah, it would.
Honestly? Yeah.
And Barry keeps saying to me, there's always time to be upset afterwards, so try and enjoy every minute.
That's special, isn't it?